are you worried that, like the DOH, there is a possibility that we could hit high numbers the way things are going? Kasi medyo ako lumabas ako, di na ako umulit. Sabi ko, uwi na lang ako sa Lipan. Nakakatakot dito sa Metro Manila. Parang nakawala sa koralang tao.
Well, I have to be honest, parang ganun nga yung nakikita natin when we see pictures sa labas, parang nakawala sa coral. I mean, of course, holidays spirit na. Pero ang concern natin is marami mga bata sa labas. Some of them are below 12 years old, nakakapasok sa mga establishments. And naiintindihan naman natin na matagal na silang hindi nakakalabas. Pero yung sa mga ibang countries na nagkaroon sila ng resurges after marami na silang na-vaccinate, usually mga tinatamaan, mga unvaccinated, tsaka yung mga bata. So that's why yung erring on the side of caution means itong mga unvaccinated and yung mga bata. We supported naman yung opening up of the economy para makabawi yung businesses natin. Pero we still want to balance it with, hindi naman ibig sabihin bukas na lang tayo ng bukas without thinking about yung mga consequences. So, yun yung mga concerns natin. Yung mga bata, yes, may overcrowding. So far, we're not seeing an increase in cases yet. Pero we agree with the Department of Health. We should be cautious pa rin naman. And kaya rin natin napababa yung cases dahil because people generally follow minimum public health standards. Pag hindi na natin nasunod yan, baka magkaroon ng pagtaas ng cases. We might not see the same numbers as before nung nagkaroon tayo ng surge, pero we could still see a rise in cases kasi ganun rin nangyayari sa mga European countries.
As far as your data, I don't know if you've studied it, no, but because logically one would think those minors who are not vaccinated should not be let out. So, ano yun, di ba, below 12, right?
Right. Yes, we agree, Sito. So yun nga yung position namin. At least ako personally, we should be careful with the minors kasi ang sabi nga ng Department of Health nasa local government, and then yung local government parang pinasa naman nila sa nationally, pero ang sinasabi rin nila nasa malls na yon. And then yung mga mall operators sabi nila, we can't control it kasi syempre malls would rather have more people than less people. Sasabihin nila it's a personal responsibility. So parang tama yung sinasabi mo it's wala nang and I agree, sana mas maganda if there's a central decision making pa rin naman. Kahit naman alert level 1 to 3, it doesn't mean na wala na yung virus. Kaya nga may alert level 1. Otherwise, di nag-open na lang tayo fully, wala nang alert levels, di ba? Kung ganun din lang naman na walang, I mean, that's my opinion. Kung wala rin naman guidelines or hindi rin nasusunod yung guidelines, what do we need the alert level for? Let's just fully reopen. I mean, that's not what I'm saying that we should do. I'm just saying na parang equivalent na rin tayo to fully reopening the economy. Sa data ng UK, when they reopened, yung mga 10 to 14, the infection rate was 15 times higher kesa sa seniors. So sila talaga yung mas nakakahawa and nakapanghawa as you mentioned. So it's correct and because most of them are not vaccinated. Tapos hindi rin sila nagsusot ng face mask na maayos. Marami ako nakikita sa malls na hindi naka-face mask na maayos. So it's definitely a concern.
The evidence is out there in other countries. When they opened, it looked like a good idea. It seemed like a good idea. But the fact that the children were not vaccinated led to problems. And now we're doing the same thing here. Parang, kumbaga hindi yata natin pinick up or hindi natin naintindihan yung implications. What are you expecting will happen with this return of face-to-face classes?
Well, it's still under pilot testing. Ako mismo dito, I mean, I would prefer na unahin natin. Of course, yung college level students, most of them are 18 and above, so most of them will be vaccinated. Yung mga high schools naman, senior high school, a lot of them will start to get vaccinated already, mga 12 to 17. So I'm less, I'm somewhat concerned. Pero kumaga, college level students, I think we could go for it. Especially may mga classes na kailangan face to face. Yung mga senior high school and mga high school, I think we could do a pilot implementation. Pero at least pag ginagawa natin yan by age grouping or at least by yung school levels, medyo mapapilot test na rin natin what are the best practices or not. So we can calibrate our I mean for me, ihuhuli ko na yung 6 to 12 na hindi pa vaccinated. I mean, maybe when the risk level is so low na, kung konti na talagang cases, maybe we can take chances kung kahit hindi pa vaccinated. Pero I know personally, maraming parents are concerned for their kids if we open face-to-face classes for yung mga elementary students, yung mga preschool. It's definitely a concern. So, yun nga, again, I'm okay with college level students. Pag mga high schools, I think it can be implemented in stages. Yung mga LM, I think maybe we could I don't know. I mean, I think they can pilot it, pero I think we should be more cautious in opening up elementary school education.